Zimbabwean government breaks silence to its citizens in South Africa. Zimbabwean government finally breaks silence to its citizens in South Africa. Ladies and gentlemen, my name is Dr. Jones, Wina TV. Please subscribe. The Zimbabwean government has officially stated that it will not be liable for the medical expenses of its citizens seeking treatment in South Africa. The announcement was made amid rising concerns over the growing number of undocumented Zimbabweans accessing healthcare services in the neighboring country. Health and Child Care Minister Douglas Mombeshara, addressing the media in Harare on Friday, said the government does not have the financial capacity to cater to medical bills incurred outside its borders. He stressed that while the government remains committed to the well-being of its citizens, it cannot extend its resources to cover services rendered in foreign nationals. Zimbabweans traveling to South Africa for medical care are doing so at their own cost and discretion. The government of Zimbabwe is not in a position to fund or reimburse medical expenses incurred abroad, said Mombeshara. This stance comes amid ongoing reports of increased strain on South Africa's public health care system, particularly in border towns such as Musina and Limpopo, where Zimbabwean nationals frequently seek urgent medical attention. South African officials have repeatedly raised concerns over the burden placed on their facilities by foreign nationals. Minister Mombeshara acknowledged the challenges faced by citizens who are forced to seek services across the border due to limitations within Zimbabwe's own healthcare system. He noted that efforts are being made to strengthen domestic health care infrastructure and improve the availability of essential services. We are working tirelessly to improve our hospitals, equip them with the necessary supplies, and retain qualified personnel, he added. The announcement has already drawn mixed reactions from the public and civil society groups, some of whom argue that the government should explore bilateral agreements with South Africa to protect the health rights of Zimbabweans living or seeking care there. However, officials maintain that given the country's economic constraints, the priority remains on investing in local health care provision rather than financing treatment abroad. This forgotten recipe cleanses the veins of an unimpressive speed. Important information. The decision highlights the broader issue of regional health disparities and the urgent need for comprehensive reform in Zimbabwe's healthcare and healthcare system. Someone commented and said that is utterly nonsense. Every country has the responsibility to care for its citizens. Zim cannot expect SA to cater for the basic needs of its citizens, We share our resources with Zim, such as water, lights, schools, accommodation, hospitals. It is not fair to South Africans. Ladies and gentlemen, my name is Dr. Jones. Why not TV? Please subscribe. Bye for now. Till we meet again next time. Subscribe.